Hello, friends. I'm Dr. Davidson. Today I'm here to talk to you about dairy and disease. Now, many of you may have seen advertisements such as TV commercials extolling the various health benefits of dairy products. However, when we actually look at the scientific evidence, it's quite clear that the consumption of animal products, including dairy products, is harmful for human health. So I'll be talking to you today about 3 reasons why dairy is the worst for babies and kids in particular, and human beings in general, and dispelling some of these myths, revealing that any advertisements with claims to health benefits regarding dairy is actually misleading or false advertising. I'm going to do this all in just 5 minutes. So many parents are familiar with colic. It's a real pain, not just for children, but for parents as well, and can lead to undue stress and postpartum depression, as well as other complications for the parents and as well as the children. It is thought to be caused by gastrointestinal discomfort from air that the baby swallows when either breastfeeding or drinking from a bottle. Now, the problem is that leading drug treatments like simethicone, which is commonly used for gas pain, shows no benefit in colic. And natural products like peppermint oil and herbal teas have safety concerns and quality issues, and therefore parents are cautioned not to use these products either. What about burping? Well, scientific evidence for burping says it was useless for colic and actually led to greater regurgitation. So that's not recommended either. So what does work? Well, it was known even in the 70s that there was a substance in cow's milk that can cause colic in children. And so the researchers did a study where they basically eliminated dairy products from the diet of women whose children had episodes of colic. And of the 19 infants whose mothers went on a dairy-free diet, 13 had prompt resolution of their colic. In other words, 13 of 19, colic completely went away, baby stopped crying. And in 12 of those 13, which the colic disappeared, once they reintroduced the dairy, re-challenged the mothers with dairy, the colic reappeared again. So they took the dairy away, the colic disappeared, they reintroduced the dairy to the diet of the mothers, and the colic came back. And, basically what was happening was the mothers were breastfeeding the children, and this substance was being passed on from the mother's milk into the children, thereby causing the colic. So this kind of evidence is very compelling, and it indicates that eliminating dairy from the diet is a very effective treatment for colic. So beyond this, there was a study in the Journal of Pediatrics and Gastroenterology, and reports of basically breastfed infants suffering from respiratory distress or apnea. And this is basically a sudden difficulty breathing for children. And it was always preceded by mother's consumption of fresh cow's milk. So when they studied the blood of these children, they had high levels of a substance called a group of compounds called casomorphines, which are found in dairy, and basically they're opiate-like compounds which can actually interfere with the breathing ability of children. Casomorphine, the word morphine is in the name, and that's no coincidence because they're basically like narcotic-like substances. So not only can they cause respiratory distress, but they can also be addictive, just like other narcotics. And the reason it's so concerning is that about 7 to 10% of infants with recurrent apnea cannot be saved, and they die of SIDS or sudden infant death syndrome. So this SIDS or crib death is actually the leading cause of death for healthy infants over 1 month of age, and sadly 1 in every 2,000 American babies die this way. And some common risk factors for this include, for instance, sleeping on the stomach, as well as high sleep room temperature and secondhand smoke. But also, these casomorphines are thought to be responsible in certain situations. And the same compounds, these same casomorphines, may interfere with childhood development and normal development of children. And so there's research to suggest that these casomorphines can cause delayed psychomotor development and other diseases such as autism. So I'm going to wrap up by dispelling some of the myths regarding the purported health benefits of dairy products, namely that dairy is high in calcium. So First of all, the calcium in dairy is trapped in a gelatinous type matrix, and it's hard for the body to absorb. But beyond this, even if it was highly absorbable, there's just no reason to get calcium from dairy, because dairy contains hundreds and thousands of compounds, and and many of the compounds it actually contains is highly harmful to human health. So there's no reason to get calcium from dairy, because uh, dairy is just it's just basically a lot more harm than any potential for good. When especially when calcium is much better obtained from health promoting healthy foods like green leafy vegetables, beans, collard greens, so many different plant based foods that are actually healthy. So this is where you should be getting your calcium from. The other common myth is that dairy products, fermented dairy products like yogurt and kefir, for instance, are high in probiotics, which are beneficial to health. Now, this is a misleading information once again, because even though fermented dairy products can contain probiotics or beneficial microorganisms, the concentration or the levels of these microorganisms found in these dairy products is not nearly high enough to have a beneficial effect when consumed by humans. And so, a certain concentration is required of these scientifically proven microorganisms, proven to be have health benefit in humans, to achieve that effect. And if you don't achieve that concentration, it's just not going to do anything. So, patients that, for instance, had courses of broad spectrum antibiotics, if they need a source of probiotics, it would not be from dairy products. It would most likely be in the form of a high quality supplement, and I could tell you more about that. But this is the end of the presentation, so I hope you enjoyed it. And my name is Dr. Davidson. You can visit Dr. Davidson, integratedmedicine.com for more information. Thank you so much.